Let's take a look at cardiac anatomy using this 3D model created by Newey of the University of Dundee. Now this is an anterior view of the heart. This is a left lateral view of the heart where this is the apex. This is a posterior view of the heart. Superior vena cava, aorta, ascending aorta, descending aorta. And this is a medial view of the heart, or the view from the right side, where this is your vena cava, superior, inferior vena cava, right atrium, right ventricle. Now, let's get back to this anterior view of the heart. Right here. Couple of things. This right here is the outline of the right ventricle. The left ventricle, we see here the left ventricular apex, and for the rest, the left ventricle is obscured behind the right ventricle, so you might as well call the right ventricle the anterior ventricle, and the left ventricle the posterior ventricle. But by convention, we call this right and this left. When taking a look here at the lateral view of the heart, we see here the apex, here the right ventricle, and what you should know is that the right ventricle actually envelops the left ventricle like a half moon. It envelops it, and the right ventricle continues as the pulmonary artery, and the pulmonary artery, back to the anterior view, the pulmonary artery in anatomical illustrations is often drawn as if it goes upright and then to the left and to the right, but actually it doesn't go upright. It lies on the heart, with here a left pulmonary artery and here a right pulmonary artery. Back to the anterior view. So here we have the right ventricle, right ventricular outflow tract, pulmonary artery. And this is the right atrium with the superior and inferior vena cava. And the superior vena cava, it receives blood from the left brachiocephalic vein and the right brachiocephalic vein. And brachiocephalic, the name says what it is. Brachio is arm, cephalic is brain or head. So this receives blood from the subclavian vein and the jugular vein. This right here is the aorta, and the aorta, you have to believe my word for it, looking at this lateral view of the heart with the apex. The aorta, it goes right here posteriorly to the pulmonary artery, and it receives blood from the left ventricle. Now, the first branch of the aorta is not the brachiocephalic artery. It's actually the coronary arteries. Now, the aorta, it has three cusps. It's a tricuspid valve in most patients. And these three cusps are named after the coronary arteries that arise from them. Most patients have a non-coronary cusp, a right coronary cusp, and a left coronary cusp. The right coronary cusps give rise to the right coronary artery right here in this anterior superior view. Well, let's take a look here at the anterior view. This is the right coronary artery. The left coronary artery, also known as the main stem, branches into a left anterior descending artery and a circumflex coronary artery. Now, coronary dominance pertains to which artery gives rise to the posterior interventricular artery, and in 80% of patients, the coronary circulation is right dominant, so the posterior interventricular artery arises from the right coronary artery. And the remainder of patients, it's either left dominant, arising from the circumflex coronary artery, or co-dominant. Now, getting back to the aorta here, the aorta, it has a number of branches, and there's significant variant anatomy, but this is the most typical anatomy, where you have a brachiocephalic artery as the first arch vessel, the common carotid artery for the left side, and the subclavian artery for the left side. Now, where do the right common carotid and right subclavian artery come from? Well, they come from this brachiocephalic artery. Now, getting back to the heart's compartments, we have the right ventricle, left ventricle. This right here is the left atrium, and this is the right atrium. So this is a posterior view, and we see that the left atrium, it has 4 vessels entering it. And these are pulmonary veins. So this is a posterior view, and here we would have the right lung, here we would have the left lung. And the right lung has 3 lobes, an upper lobe, a middle lobe, and a lower lobe. And typically the upper and middle lobe fuse to form one pulmonary vein, whereas the lower lobe enters here as the lower lobe pulmonary vein. This is the left upper lobe pulmonary vein, and this is the left lower lobe pulmonary vein, which enter here to give oxygen-rich blood back to the left atrium, which will then enter the left ventricle, which will then go through the aorta. Now, one outpouching of the left atrium is right here. You can see here, this is the left atrium, and this is an outpouching of it. And that's the left auricle. And the auricle is quite irregular. It's quite, it's a dark corner of the left atrium. And this predisposes to stasis of blood and subsequent thromboemboli formation, especially in patients with atrial fibrillation, where the coordination of atrial contraction is limited or actually absent, so that thromboemboli can form. And this is an important spot for ultrasonographists and people interpreting MRIs and CTs to evaluate whether there are thrombi in the left auricle. There's also a right auricle, but this predisposes much less to thromboemboli. So yeah. Oh yeah, one more thing that's good to mention. This is the posterior view of the heart, right atrium, inferior and superior vena cava, as we said. Cardiologists sometimes place pacemakers or ICDs, and they do that typically by entering the left subclavian vein and then left brachiocephalic vein and then entering the right atrium and then leaving a lead in the right atrium and in the right ventricle. Sometimes they want to do biventricular pacing, where they also pace the left ventricle. But how do you arrive at the left ventricle if you've entered through the right atrium? Well, one thing they do, which is pretty smart, is they use this vein. This vein brings back deoxygenated blood used up by the myocardium, brings it back to the right atrium. And what cardiologists do is they place a lead in this vein, which is called the coronary sinus, and retrogradely place the lead here. They fit it epicardially over the left ventricle so that you effectively have left ventricular pacing, even though the lead is not within the left ventricular lumen as it is for the right ventricle and the right atrium. So that's a really cool thing. So that's the heart in a nutshell. We just went through it, looked at some of the important structures. I hope you enjoyed it.